long-term care is very different compared to a hospital, where it's very much you get people out and you're moving them on. It's kind of that, you're treating them, you're moving them along, you're treating them, you're moving along. People here are family. They're our family. Our residents are our family. Our coworkers are our family. They spend, more time with us than they do sometimes their loved one, and you want to protect them in the best possible way that you can. So then when you hear these stories about, long-term care this and nursing homes that, and you're like, whoa, like, we're here, we love them, and we're doing everything possible that we can within our means to protect them. Like you had said, trying to keep up with guidelines. 1 minute it's this, 1 minute it's that, 1 minute, no visitation, next minute there's essential and compassionate, and then wait a minute, no, now it's just compassionate, and they can be in the room, they have to be outside. It was just trying to keep up with all that.
Constant education and re-education, because it's not that the staff want to not be compliant, but there's just so much going on. And especially if when we were in the surge and the pandemic, and the surge in the beginning of the pandemic, when we had cases, we're out there, you're taking care of residents that are very sick, but we had to make sure that they were following those protocols as well. Residents continue to have, even though they're wearing masks and everything, with their eye, they're still seeing like, they are, they understand the restrictions, but they also are so appreciative that everything that's been done for them and continues to be done, and how we've, everybody's looked out for their best interest and to make sure they stay safe. And so they're still saying they wouldn't, want to be anywhere else but here.
I think we're the common denominator, and we're the people overseeing the common denominator, which is they're at end of life. These are the most vulnerable. Mm-hmm. So with this pandemic and the disease process, it affects that population. So it's very easily to, from a population health perspective, to look at our industry and say, that's the problem. They don't see the department heads in the middle of an outbreak moving residents out and on their hands and knees in PPE, sweating, drenched in sweat, cleaning surfaces.
I never wanted to have to tell my family, hey, listen, COVID's in our building and my grandma has it, And still, it took me a while, and still I think about all the things, like what could we have done better, or what could we have done differently to have protected the people? And the answer is we were doing everything that we could have. I mean, everybody stretched to their limits, taking the right precautions, doing the right things. We were, making sure, because we knew obviously if it came in, it would be through a staff person, and so we were making sure we were tracking, we were testing when we had tests, we were testing, and we were working 7 days a week to make sure, if somebody even had a sniffle, we're like, don't come in, we'll get somebody else to do it, and one of us would come up, because we were just trying so hard not to be another statistic. We didn't want to be another number.